So first coming to
Okay.
maxillary first molar, this is from the buccal aspect. You have two buccal roots, and this is from the lingual or palatal aspect where you have one root from the palatal,
Okay,
then
ma'am.
mesial and distal, and this is the occlusal surface.
Okay, ma'am.
Okay, occlusal surface has four cusps and one accessory cusp which is called cusp of Carabelli. Okay,
Okay, ma'am.
so
Okay.
it has two buccal roots, mesobuccal, distobuccal, and one palatal root. Okay, maxillary first
Yes,
molar.
ma'am. Yes,
So
ma'am.
the maxillary first molar is the tooth located laterally away from the midline of the face from both the maxillary second premolars of the mouth, but mesial to maxillary second molar. Correct?
Yes,
Distal
ma'am.
to premolar, mesial to second molar.
Yes, ma'am.
The function of this molar is similar to that of all the molars in regard to grinding being the principal action during mastication, commonly known as chewing.
Yes, ma'am.
So first evidence of calcification at birth. Crown
Okay, ma'am.
completed 3 to 4 years. Eruption
Yes,
6 to
ma'am.
7 years. Root completion 9 to 10 years.
Yes, ma'am.
Okay, this is the first teeth which replaces the deciduous teeth. First permanent molar is the first permanent teeth which comes in the oral cavity.
Yes, ma'am.
Okay, so you should
Yes,
know all
ma'am.
this chronology. Okay, 3 to 4 years. Eruption 6 to 7 years. Root completion 9 to 10 years.
Yes, ma'am.
Coming to detailed description from the buccal aspect. It is trapezoidal in shape. See, it is trapezoid. Okay.
Yes, ma'am. Yes, ma'am.
Parts of all four cusps are visible. 1, 2, 3, 4 cusps. And the fifth cusp is optional. It is sometimes present, it is not present. So we don't consider it as a functional cusp. Okay.
Okay, ma'am.
Then the portion of the distal surface can also be seen from the buccal aspect because of the obtuse distopalatal line angle. Okay.
Yes, ma'am.
Mesobuccal cusp is the larger cusp of the buccal. Among the buccal cusps, mesobuccal cusp is the largest cusp. Okay.
Yes, ma'am. Yes,
Has a prominent buccal groove that continues over from the occlusal surface. So this groove continues from the occlusal surface towards the buccal side. Okay.
yes, ma'am. Yes, ma'am.
Then proximal contact areas in the midline, middle third. From one, the second molar contacts the first molar in the middle third area of the crown.
Yes, ma'am.
All three roots are visible from the buccal aspect, one palatal root and two buccal roots.
Yes, ma'am.
From the buccal aspect, the teeth will look something like this. And here, what in DA, you should know the diagrams. Like the tooth in all the aspect, you should know how to draw. Because diagrams are very important when you're explaining the tooth in DA.
Mm.
And you know how the
Yes, ma'am.
diagram has to be. I'll show you. The diagram should look something like this. You've written DA record by any chance?
Yes, ma'am.
So
Yes,
in the
ma'am.
graph paper, you have drawn diagrams, right?
Yes, ma'am.
So the same way it has to be in the exam, the diagram. Each
Yes.
aspect, you draw the diagram, explain about that. Okay.
Yes. Yes, ma'am.
So palatal aspect outlines reversed buccal aspect. Still it's trapezoidal in shape. Mesopalatal cusp is the largest. Distopalatal cusp is the smallest. Has a
Yes, ma'am.
palatal pit. The
Yes,
cusps
ma'am.
they may be cusp on the palatal surface of the mesopalatal cusp. That is what is called cusp of Carabelli.
Yes, ma'am.
This one.
Okay.
This is the
Yes,
fifth.
ma'am.
This is the
This is the
fifth
fifth.
cusp called the
Yes.
cusp of Carabelli, which is visible in addition to the four cusps on the occlusal surface. So see what this is meso from the palatal aspect. If you see the tooth, this is mesopalatal, distopalatal. So mesopalatal is
Okay.
the largest cusp, and there is one palatal pit.
Yes, ma'am.
Okay, and there may be a cusp sometimes present, which is called the cusp of Carabelli. Okay.
Which one, ma'am?
This here, it's not that prominent. It's not that visible. See
This
here,
is the fourth.
something like this. It look like this.
Oh, okay, 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 ma'am. Okay.
This is the mesopalatal cusp, distopalatal cusp. All along the line of the mesopalatal cusp only, you will get this smaller cusp, which is called cusp of Carabelli.
Okay, ma'am.
Mesobuccal, mesopalatal, and fifth cusps are visible from the mesial aspect.
Okay.
This you have to just by heart DA, okay? There is no way that you can understand anything.
Yes.
You have to just mug up because otherwise you have to imagine the tooth. Like if you have carved it, just keep the tooth near you and try to visualize when you're reading. Then it will be easier for you.
Yes, sir.
Otherwise, if you have to just read it like that, nothing will enter your head. Okay.
Yes.
Mesial marginal ridge, confluent with the mesobuccal cusp, mesopalatal cusp ridges and curved cervically. The contact areas at the junction of the middle third and occlusal third. Shallow concavity just below the contact area. Cervical line irregular and curves occlusally.
Okay.
This is the cervical line. So this from the mesial aspect. So distobuccal cusp and distopalatal cusps are seen. Marginal ridge dips sharply cervically. More of occlusal surface seen because of the distal tilt of the crown. Cervical line almost straight. See, okay, first imagining a maxillary molar in your hand. The crown, it has 4 main cusps and 1 accessory cusp. 4
Okay.
cusps are mesobuccal, distobuccal, mesopalatal, distopalatal.
Yes.
Okay, first the general idea.
Yes,
4 cusps, 3 roots. One is mesobuccal, distobuccal root, one is palatal root.
okay.
This is the basic idea.
Okay.
So now, if you see the tooth from the buccal side, you can see the mesobuccal cusp, the distobuccal cusp, the 2 buccal roots you can see, and you can see
Yes,
a groove, occlusal groove, which is extending into the buccal side. And the shape is almost trapezoidal. This is from the buccal aspect.
Yes, ma'am.
So coming to the palatal
It's from the
aspect.
distal aspect, no?
No, I'm generally telling. Buccal, what is it? Okay.
Okay, ma'am. Okay.
Then after that you have palatal. So when coming to palatal, you can see mesopalatal, distopalatal cusp. Mesopalatal is the largest, distopalatal is the smallest cusp. The shape is trapezoidal. There is
Okay,
a
ma'am.
palatal pit and you can see one palatal root, single palatal root. And along the mesopalatal cusp, you can see some accessory cusp called cusp of Carabelli.
Okay, ma'am.
So much you remember about palatal side.
Okay.
You're jotting down the point somewhere.
Yes, I'm just writing down basically.
Okay, jot it down. No. If you put it down, no, it's easier for you to understand. So now buccal and palatal is clear.
Yes, ma'am.
Coming to mesial, from mesial, what you can see? Mesobuccal, mesopalatal. 2 cusps you can see. And sometimes cusp of Carabelli, if present, even that is visible.
Okay.
Okay, then you can see mesial marginal ridge.
Yes, ma'am.
Mesial marginal ridge you have to see. Then again you have to see the contact area. Because tooth is contact in mesial and distal side. Buccal and lingual there is no contact, no? One tooth to another is only contact in mesial and distal. So where the contact points are established, that you must write it down in mesial and distal aspect. So in mesial it is in the middle and occlusal third.
Okay, ma'am.
Okay, and there is a concavity just below the contact area from the mesial side. See, if this is the contact point, there is a concavity just below this, like a depression.
Okay.
Cervical line is irregular from mesial side. Cervical line is straight from distal side.
And then this we can see the cervical line, no?
In this, cervical line is seen only in mesial and distal side. It's more prominent. In mesial side, it is irregular. Okay,
but in this photo,
only
it's
so much.
not visible, right?
Huh? No. Okay, mesial cervical line is irregular.
Okay.
So this is about mesial aspect.
Okay.
So coming to distal aspect, you can see distobuccal and distopalatal cusp.
Yes, ma'am.
You can see again distal marginal ridge.
Yes, ma'am.
And you can see the contact is in the occlusal surface.
Yes, ma'am.
Then cervical line is straight.
Okay.
This is about distal. So now all the 4 aspects I've made it clear.
Yes, ma'am.
Okay, so coming to occlusal. So occlusal rhomboidal in shape.
Okay.
Mesial side is crown mesially and palatally wider than distally and buccally.
Okay, ma'am.
So if this is the mesial side, mesial, distal, buccal, palatal. So mesial side and palatal, this side. So this side is wider than this side. Because here you will have this cusp of Carabelli also.
Yes,
So mesopalatal cusp, you'll have cusp of Carabelli, no?
Yeah, you
So
can see.
this
Yes,
L shape is wider than this L shape.
okay.
Mesial side, palatal side.
Okay.
Buccal side, distal side, correct?
Yes, ma'am.
So distobuccal is narrow.
Yes, ma'am.
Mesopalatal is wider.
Okay.
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 Intersection of mesial and buccal surface forms an acute angle. Mesial, buccal, this is an acute angle.
Okay.
Three largest cusps form a triangle. Distopalatal least developed cusp. Pronounced
Okay.
oblique ridge. We have mesial oblique ridge and distal oblique ridge.
Okay, ma'am.
Then three occlusal fossa. Mesial fossa, central fossa, distal fossa.
Okay.
So from occlusal aspect, what you can write is rhomboidal in shape.
Yes, ma'am.
Mesopalatal is wider than the distobuccal.
Okay, ma'am.
Three cusps form a triangle.
Yes, ma'am.
And then three occlusal fossas are present, which is mesial, distal, central.
Okay.
Distopalatal cusp is least developed.
Okay, ma'am.
Okay, this is about the occlusal aspect. So coming to occlusal aspect in depth, you have four cusps: mesopalatal, mesobuccal, distobuccal, distopalatal. Mesopalatal is the largest, distopalatal is the smallest. Okay.
Ma'am, occlusal aspect as on which side, ma'am?
What?
Occlusal aspect
On
as
the
on.
top, from top if you see.
Okay. Okay.
Sides is mesial, distal,
No,
buccal.
ma'am, that I understood. So there are,
Top is occlusal. Top.
why are the four cusp sides, ma'am? Oh, from each side. Okay. Okay. Got it, ma'am. Got it, ma'am. Got it.
And understood?
Yes, ma'am. Yes, ma'am.
Okay. So there are ridges. Ridges are nothing but these. These are called ridges on the occlusal surface.
Okay, ma'am.
There is mesial marginal ridge, distal marginal ridge, and oblique ridge, which joins these both.
Okay, ma'am.
Then fossas is major. There are three fossas: mesial, distal, central. Correct?
Yes, ma'am.
You don't remember major, minor, and all. Just remember three fossas. Okay.
Mesial, yes, ma'am.
Mesial, distal, central.
Okay, ma'am.
Then coming to grooves, there's buccal palatal developmental groove, which continues on the buccal side as well as on the palatal side.
Okay.
Central, buccal, palatal, three developmental grooves.
Okay.
Then you have distal oblique ridge. Then
Yes,
you
ma'am.
have transverse groove. Then you have
Yes.
fifth cusp or the cusp of Carabelli groove. Then you have the other smaller supplementary grooves.
Okay, ma'am.
And you have a deepest depression on the occlusal surface, which is called the central pit.
Okay.
In the central aspect. Okay, this is all about occlusal aspect.
Okay.
This is the central pit.
Okay, ma'am.
So that is about the crown. So now we have noted down the points: mesial, distal, buccal, palatal, and occlusal.
I just wrote one word, ma'am. For it.
Okay, fine. No, if you can understand it later, it is fine.
Yes, ma'am.
The root, coming to the root, maxillary first molar has three roots: two buccal,
And this is
one.
the only teeth with three roots, right, ma'am?
Yes, correct. Okay, two palatal, two buccal, one palatal.
Okay.
Palatal root is longer and slender.
Okay.
Mesiobuccal root is broader and curves distally. Distobuccal root is narrow at the base and a lot straighter. So that is like, one root is curving. One
Oh,
root
yes,
is
ma'am.
going straight. In buccal, two roots. One root curves, one root goes straight. Okay.
Okay.
So that is what they've given here as mesiobuccal root is broader and curves. Distobuccal root is narrow and is straight. Okay.
Okay.
Buccal roots are of equal size, smaller than the palatal root.
Okay.
Level of bifurcation closer to the cervical line, mesially and distally. So that is where the roots divide into three. No, that is called bifurcation. Furcation point. That point is more mesial than distal. So it is more towards the midline, not away from the midline. Okay.
And we have to write this exactly like this in the answer, no,
See,
ma'am?
okay, when it comes to root, what you have to write is maxillary first molar has 3 roots.
Okay.
First point. Second point, it has mesobuccal, distobuccal, and and palatal. 3 roots. Name the roots in the second point.
Okay, ma'am.
In the third point, palatal root is long and slender.
Okay, ma'am.
Fourth point, mesobuccal root is
We have to
broader.
remember all that, no, ma'am?
No, you have to remember. Just at least after that, you just, if you don't write this also, you write both the buccal roots are of equal size and palatal root is thin. At least this one point you remember.
Okay.
Palatal root is thinner than the buccal root. Okay.
Okay. Okay.
And bifurcation area is closer to mesial than distal.
Okay.
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 That is all about maxillary first molar. Then coming about maxillary canine. Canine from labial aspect looks like this. From lingual has this. What do you call this?
Cusps. No?
Canine has cusps.
No,
Huh?
okay, then it is fossa, no?
Fossa. Then this is mesial, this is distal, this is occlusal. Okay.
Okay.
So coming to introduction, canines are very long and stable teeth. There are 4 canines, 2 maxillary, 2 mandibular, placed in the corner of the mouth and hence called the cornerstones of the dentition. Single pointed cusp present, so also called cuspids. The canine role is mastication is mainly tearing, which is intermediate between incising of anterior teeth and grinding of the posterior teeth. Okay.
Okay, ma'am.
Arch position, the permanent maxillary canine replaces the deciduous maxillary canine and is located third from the midline in each maxillary quadrant. Mesial contact is with lateral incisor. Distal contact is with premolar.
Mark means?
Arch. This. See, teeth are placed in arch. This is called arch. See, this is one arch.
Okay, like that. Okay.
In this arch, canine is placed distal to maxillary lateral and mesial to maxillary first premolar. In the arch, this is one dental arch. Upper arch, lower arch.
Hello. Yes,
Okay. So coming to tooth numbering, it is named as in Universal it is 6, Zygmundi Palmer it is 3 and 3, and FDI 1, 1, 3, 2, 3. Okay, so before this I'll just brush through what is tooth numbering system. Okay, there are 3 types of tooth numbering system. One is the Universal system, Zygmundi Palmer, and FDI system. Okay, so I'll just wait. I'll just show you like. So I just drew, this is one arch. So third molar, second molar, first molar, second premolar, first premolar, canine, central, lateral. Again, this side you have central, lateral, canine, first premolar, second premolar, first molar, second molar, and again you have the third molar. Okay. This is the teeth arrangement in normal dentition, correct? Permanent teeth, it is arranged like this. Am I audible? You can see the screen.
Yes, ma'am. Yes, ma'am.
Yeah. So I was telling you, heard this? What I told you? What are these lines?
Yes, ma'am. Yes, ma'am. Those are tooth, right?
Yeah, correct. So what? Which tooth is this?
That's the third molar. Left.
This.
Second molar.
This.
First molar.
This.
Premolar, canine.
Hey, how many premolars?
No, two premolars.
You should tell second premolar, first premolar, then canine, then lateral, central. Okay.
Yes.
So much is the midline. Here is the midline, and here is again the central incisor. Okay, this is the midline. Yes, so in universal system, how do we do tooth number is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. And again from lower 17, 18, 19, 20 till 30. How many? 30 or 32?
34, right?
Hmm?
34, 32.
34. How did you get two extra teeth, Vishnu?
34. No, ma'am. I was thinking third molar.
Elementary.
Third molar. Third molar didn't come now. That's why I came to 34.
Okay, so 32. What is the dental formula?
2, 3,
Ah,
2. No.
2,
2, 1, 2, 3.
2, 1, 2, 3
No?
by
Same thing, no? 2, 1, 2, 3.
2, 1, 2, 3 by 2, 1, 2, 3.
Yes,
This is the
yes.
complete formula. You should not tell only 2, 1, 2, 3. You should tell 2, 1, 2, 3 by 2, 1, 2, 3.
Yes, ma'am.
So how much it will be? 3, 4, 5, 6, 7, 8. 8 into 4? 32.
Yes, ma'am. Ma'am, I got confused because
In this, even third molars are included.
third molar came into my mind. Yeah, that's what I forgot that. Suddenly I forgot that, ma'am.
So you told 30, is it?
I told 34 because I know 32. Then I added 2 premolar and told 34.
Oh, okay, yeah. Okay, fine. So your universal system 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Again 17, 18, 19, 20, 21, 22 till 32. That is how you name the teeth in universal system. Okay. That is why in this PPT we have as 6 and 11. 6 is why they have given 6 is, see, from here if you count 1, 2, 3, 4, 5, 6. This side canine will be 6 in the upper arch. Then 7, 8, 9, 10, 11. The other canine will be 11 in the upper arch. So in universal system, you name the teeth as 6 and 11. Any teeth for that matter, you have to name it like that. Because tooth numbering system is also an important question in the exam. This is universal system. Clear?
Yes, ma'am.
Now coming to after Zygmundi-Palmer. Okay. So Zygmundi-Palmer, what do we do is, again you draw the arch.
Okay.
And you remember, okay, third molar, second molar, I don't have to draw that, okay, just know that. So here you have to divide into 3 quadrants. 4. Upper right, no, upper left, upper right, lower right, and lower left. Okay. Just put your hand, just see from upper left, upper right, then below upper right is lower right. Then below lower right is lower left. So it goes in clockwise anti-clockwise direction.
Okay.
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 So suppose in Zygmundi-Palmer notation, if they're asking you to write maxillary, they're asking you to write maxillary left first molar. Okay.
Yes, ma'am.
So that will be like which tooth in this? First molar is tooth number 6. Correct?
Yes, ma'am. Yes, ma'am.
From this Zygmundi-Palmer, you have to count from central. Central is 1, lateral is 2, canine is 3, premolar 4, 5, 6, 7, 8. And again 1, 2, 3, 4, 5, 6, 7, 8. In this in FDI, it will be 1, 2, 3, 4, 5, 6, 7, 8, 1, 2, 3, 4, 5, 6, 7, 8. It is not like whole thing in one number. Okay.
Okay.
Wait, I'll draw a little more neat picture, then you will understand. Okay. In this, you have the midline. Okay. Have this is third molar, second molar, first molar, first premolar, second premolar, canine, lateral, and central is here. Again you have central, lateral, canine, first premolar, second premolar, first molar, second molar, and this is the third molar. Okay.
Okay.
So here you have to name the tooth as, this will be 8. Okay.
Okay.
So this will be 8, and here again it will be 7, and here again it will be, no, yeah, again it will be 6, and this will be 5, this will be 4, then again this will be 3, again this will be 2, and this will be 1. Then again here it will be 1, here it will be 2, this will be 3, this will be 4, 5, this will be 6, this will be 7, and this will be 8. Okay, so this is the tooth numbering. Central, lateral canine, first premolar, second premolar, first molar, second molar, third molar. Okay. So when it comes to Zygmonti-Palmer, what happens is you have to divide the teeth into 4 quadrants. Upper left, so this is upper left, this is upper right. Lower I have not drawn, okay, it is just the similar like upper, it just reflects down. So if they're asking in Zygmonti-Palmer, this tooth, first molar. Okay. So when you plot a graph, here again it will be upper left, this will be upper right, lower right, and lower left. Okay, this is how it is in the graph. So if they've asked you about 6, this maxillary left first molar, so tooth numbering should be like 6 with this and this notation. So it indicates this quadrant. It has to be written in this notation. Suppose if they have given you upper right, they've asked you 7. So 7 is the tooth number. Which quadrant? Upper right is this quadrant. So the tooth has to be written like this. Upper right, the tooth comes like this. Upper left, it comes like this. Suppose if they ask you lower 4. The down of this 4. So it comes down of this is this. So like this, and 4. Tooth number 4 in this quadrant. Okay. So lower left, if they ask you 3, 3 is the tooth number. Which quadrant? Like this, like this. So the sign of the thing, quadrant with the tooth number should be written. That is in case of Zygmonti-Palmer. Did you understand?
Yes, ma'am.
Are you sure, or do you want me to repeat it once again?
Ma'am, can you repeat it one last time?
No, it is fine. If you ask me, I will explain, because in the exam also they'll ask this question. See, coming to tooth. This is how the tooths are arranged in the arch. Clear?
Yes, ma'am.
1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. This is the midline. Okay.